So when I just walked in, I heard Dr. Saxena, who is a very famous electrophysiologist, cardiologist from Delhi, talk about the Bluetooth connectivity and also about, certain questions were being asked regarding how this could change or interfere and what are the dangers with it. I'm going to talk about a little bit about that in detail. Well, my topic today is smart at heart, and that is smartphone connected pacemakers. So if I take you back to the evolution of this, couple of decades back the whole story started, about 40 years back. And the first device was a wearable device. As you can see, the first device here. So this was a big wearable device, and the wires were outside, and the patient needed to carry it. And then came a big breakthrough. And that big breakthrough was implantable pacemaker. So you could put that pacemaker inside the body, and the leads could be attached, which could pace the ventricle. And over the years, we have had so many advances. Initially, we were just trying to pace one part of the heart, which is the right ventricle. And then subsequently, other pacemakers came, which could pace two chambers of the heart. It could increase the heart rate. Some of them were also MRI compatible. And now, today, we have pacemakers in which we need not cut open, but can be implanted through a transcatheter procedure, which is we go through the femoral vein and then we can implant it. So, this journey which began with wearable pacemaker has now really gone ahead. And if I talk about pacemaker, it's not just the pacemaker, it is the whole gamut of devices. There are devices which are known as ICDs, which pick up arrhythmias and give a shock to the patient, and they have prolonged human life, especially in patients of heart failure and arrhythmias. Then there are devices which could also help you in treating the atrial fibrillation, so on and so forth. So what is new is the Bluetooth enabled pacemakers. So how did we interrogate the pacemaker? How could we look at the parameters, what the pacemakers is pacing, and could we change it? We have come a big way. Say about 25-30 years back, if you look here on the side, the A diagram which you see here, this used to be a huge device. And there used to be a handle which used to be crank. It was just like a coffee grinder. And you could increase the heart rate or decrease the heart rate by putting this big device over the pacemaker where it was implanted. Then came the first magnetic programmer, which could also increase or decrease the device or increase the output also, but nothing else could be done. Now, these are still the backbone, how we look at the pacemakers, how we interrogate these devices, which again connect through a magnet device, and they can also connect through the radio frequency and also through the Bluetooth. So what is this? This is a new Blue Sync devices, and these are smart sync programmers, which are tablet based or a PC based programmers, which can be used to look at the pacemaker parameters and also to do a remote monitoring of such patients. A patient can fix the appointment and it can be done like that. And up till now, there used to be a device which used to be bought by the patient, and the patient could place one of the end on the pacemaker and it could transmit signals and that could be seen. Now what has changed is the last thing which you see. Now we have capability to transmit these signals through a Bluetooth and then onto the server straight to the physician. So this is the advantage of the Bluetooth pacemakers. So why there is a need? Every year about 40,000 devices are implanted, and we know that large number of them are active. And if you look at the various kinds of devices, if you look at the device which is ending with P, these are the pacemakers, and which end with D are those which also can give a shock. So we must follow these patients up just to know how these patients are doing, how much is the battery left, and if we can improve their lives by changing certain parameters. So there have been a lot of studies, and one of the studies looked at it that patients who were not monitored through remote versus, and if you look here, there are 3 lines which you see. The lower one is remote monitoring, which was done, but not very frequently versus none. Even then, the patients were better. There was a much better survival among them. And overall, this study showed that if the patients were taken up for remote monitoring, then 53% greater survival is there. And that is the reason, that is the need for remote monitoring. Many times we know it's very common, we have implanted the device, patient is doing well, he goes back to his hometown or small village, then forgets about it, initially comes for a few hours, and then he's lost to follow up. And then one fine day he comes again with very low heart rate, if he's lucky to survive, and then we need to change the pacemaker. So it would take care of all these issues which have come. So what is Bluetooth? We all know Bluetooth is a way by which we can connect devices. Now, the problem is these Bluetooths, they also consume a lot of battery. And the battery in the pacemaker is very, very important. If you lose it, then the longevity of the device is reduced. So they enabled a new technology, which is the Bluetooth low energy technology, which uses much less battery. So that brought about the change in the pacemakers. That has been one single thing which has enabled this particular technology to flourish. There are various devices, and one of the worldwide leaders of this is Medtronic. They have BlueSync technology which is available, and what they have done, it uses the low energy Bluetooth communication possible. And how does it work? When you've implanted this device, it would search for the device where it could interact every couple of hours, every 3 minutes. And then every couple of hours, it would give the data, which is again transmitted to the Medtronic central area. And then from there, it is sent to the various stakeholders, the doctors and the others, and they can take the remedial action. So the applications are rapidly progressing, and what we see, it enables a much better patient engagement, and also today we can wirelessly program the devices through this BlueSync technology. And this is a kind of an app which you need to download on your phone, and which could give you the various vital parameters. It could also tell you about the various information regarding your pacemaker and the battery display, and would give you alerts as well. So one question was asked when I was sitting there, that these days patients keep on changing their mobiles, but each time when they change their mobile, they'll have to download this particular application. It's so simple. So this application would enable the transfer of the data with this. And this is very simple. I'll not like to go in great details regarding this app, but what I like to tell you that there have been questions which have been raised regarding its safety. How come if someone else could access the device? But this is programmed. The communication, if you really look, is been taken care of. It cannot sync with all Bluetooth. It will sync with only very, very specific devices. And only then you could use it to program it. It is not possible, like if someone is having a Bluetooth capable pacemaker, you go near the patient and you can connect with your phone or something. That's not possible. It can only connect once it is authorized, and only with very, very few devices, selected devices. So these issues have been there, but fortunately, they have been almost taken care of. And they have come up with these Azure security features. And these Azure security features enable communication, but sort of they lock the parameters. And it can be done only with a couple of various passwords which are with access to your treating physician only. So just to summarize, we know that this technology is there. We know this is a patient-friendly technology. We also know that it does not prolong the hastening of the battery downgrade. We also know that it is possible to remotely access our patients down below without them buying any other costly equipment, just by using this Bluetooth technology. Thank you so much for your kind attention.
Nice presentation, sir. So what is the additional cost for this?
Yeah.
Over previous one?
Yeah, so additional cost, if you really look, is not really much. It adds on to about 1 lakh rupees or so, for the conventional pacemakers.
Right. Any question?
Up till now, it's just been about a couple of years where they have been put, so no real world data is there. So one can only extrapolate that given the battery life, it would be typically lasting at least 7 to 8 years. But the only thing is that once we have the real world data, then we really know that how much it impacts the battery life. That's the only single concern with it. There is no other concern at all.
Who will be recommending, or even a general physician can recommend, so that we know that there is an irregularity in the ECG which needs to be addressed, and we can send to an electrophysiologist.
So there are a couple of things. One, if a patient has already a pacemaker implant, so that cannot be switched into a Bluetooth mode. So a new device, when it is being implanted, then the implanting cardiologist can discuss with the patient and attendants and offer them that, look, this technology is available. It comes at an additional cost, maybe just about 75,000 or more. But these are the great advantages which are there. So once you have put in that device, then you can do all this. Otherwise, no one can use it just like that. And not with the pre-existing pacemakers.
It should be new.
Yep.
I have a question. Even say the mobile that remains with the patient can see the abnormalities in the pacemaker. Do the patients can send it to the implanting doctor that messages or not?
Yes, one can.
So suppose implanting doctor is sleeping at the midnight. So how we can help the patient?
No, that is not possible. Then you need to get in touch with the emergency staff, and somehow, you need to get in touch with your physician.
This is possible during working hours also?
No, it depends. Some of the doctors would get alert and would get up and do it. It depends. Don't we get up at night, when patient come with MI or something. It is something like that. The same thing.
Yeah, so what happens this thing is pretty much new in India. Although it is the need of our hour in India, because there are many remote places where people get pacemakers and nobody can go and they have to come all the way to the city. But this technology is very mature in places like US.
Yeah.
So what happens there is that these alerts are downloaded over servers, where through algorithms or through actual people sitting, they are triaged into low emergency alerts and high emergency alerts. So depending on that, then actually in US there are systems where the hospitals, the implanting hospitals have their own teams which look after these alerts, and if required they. But by and large, the advice remains the same, that if you are having any problem because of the pacemaker, the best thing to do is to go to the nearest emergency room. That is the only thing.
So the idea is they are not emergency alert devices, but as Dr. Vivek said, systems can be made into place if the number of devices that are put gets more and more in our country. I think the company also have some kind of a central monitoring system where high degree alerts, if they are there, then they contact the patient that, okay, this is something which needs immediate attention, go to the nearest hospital. Because if the idea is these devices are usually put in patients who are otherwise in a remote area. So if somebody is living in Delhi and within 5 kilometers of a big hospital, it doesn't really make sense in putting that device in those patients. But somebody who's in some remote area in some other country, that is the place where at least we will know the problem is with the device or problem is not with the device. If the problem is with the device, what is the immediate action that needs to be taken, that the patient has to go to the nearest hospital. So sometimes you don't have people to integrate the device also, but with this you will get the information, and at least we can tell the remote doctor, okay, this is the situation, do this, and then probably send the patient.
Can we generate, we can charge battery from our electric impulse or something like that?
No, up till now we don't have any rechargeable pacemakers. So it's inbuilt lithium battery.
After 7 to 8 years, you will change that.
Yeah, and sometimes, it depends on the use of battery, and many times these days the pacemakers are lasting very long, 15 years, 14 years, so it just depends on the use.
As you said, every 3 minutes it will send some signal.
It will send some signal to look for a device where it can connect and transmit the data.
So in one time, it can be connected to one phone.
Only one device.
If that person switch off their Bluetooth, and then other phone can be connected?
No, until and unless that is authorized to use, that has that particular app, and it also has that authentication number. Otherwise, it won't.
So in the emergency situation, if James had put that pacemaker, if a person goes to some other place, some physician or cardiologist, then how?
It can be done. Then they can get in touch with the company. They can authorize it, the use of that particular device.
So company is one, so any cardiologist can connect with that.
No, not any. There are certain, areas, because to improve the security, one cannot have access to each and every person. That is the reason.
So only the implanter will have access to the device. So if there are certain situations where it is required by somebody else, the implanter or the company can give the report to them. And secondly, it's not every 3 minutes. It will try to assess the base or the phone, but you can program how frequently the data is submitted. So not every 3 minutes the data will be submitted. You can
Yeah.
have once in a day the data is submitted, or once in a week the data is submitted, because most of the time you don't need so frequent information. And plus there are alerts that are built in. If that alert situation is developed, then the data will be sent immediately. So that's how it works. So it's not that every 3 minutes it is sending data, because then
Yeah,
again
exactly. So the whole idea is that without even patient coming to know, automatically it connects and sends the data, so that patient is not even aware that what is happening. Okay? And then it would send an alert back if there is something wrong on the app. Okay? That sort of a thing.